The governor of Maine has vowed to exercise the full extent of his authority to quarantine a nurse who treated Ebola patients in Africa. Paul LePage said negotiations with Kaci Hickox, who last week returned from Sierra Leone, over the terms of her isolation had broken down. Meanwhile, Ms Hickox, who is free of Ebola symptoms, went for a bike ride. Nearly 5,000 people have died of Ebola, but only 9 patients have been treated for the virus on U.S. soil. More than 13,700 people have been infected in total, the vast majority in the West African countries of Liberia, Sierra Leone and Guinea. Ebola, which is only spread through close contact with the bodily fluids of a sick patient, has an incubation period of up to 21 days, during which patients neither show symptoms nor are infectious. In other developments, a UK ship has arrived in Sierra Leone carrying food, medical equipment and 32 pickup trucks, to help keep hard-pressed Ebola treatment centers in operation. North Korea has instituted a 21-day quarantine for any foreign national arriving from any country. The World Bank said it would immediately provide $100 million to fund the deployment of more health workers to West Africa. U.S. officials are at odds over whether American healthcare workers who return from treating Ebola patients in West Africa should be forced into quarantine until that period has expired. At least 6 American healthcare workers contracted the illness there. One of those, Dr. Craig Spencer, traveled around New York City before he fell ill. He is currently in isolation in hospital. After his case was announced, New York, New Jersey and other states ordered the mandatory quarantine of healthcare workers who had been exposed to Ebola patients. But President Barack Obama has warned that overly restrictive measures imposed upon returning healthcare workers could discourage them from volunteering in Africa. On Thursday, Mr. LePage's office said it had hoped Ms Hickox would adhere to all suggested CDC guidelines for healthcare workers at some risk of having Ebola. Those include refraining from going out in public save for solo exercise or walks, staying off public transport, submitting to direct monitoring, and agreeing to coordinate travel with public health authorities, among other measures. But the guidelines only recommend direct, daily observation of the person's health by local health authorities, with the other measures suggested depending on the individual case. I was ready and willing, and remain ready and willing, to reasonably address the needs of healthcare workers meeting guidelines to assure public health is protected, Mr. LePage said in a statement. The governor's office did not disclose what steps it would take to force her compliance, but said, Maine statutes provide robust authority to the state to use legal measures to address threats to public health. Ms. Hickox returned to the U.S. on Friday, landing at Newark International Airport. Officials say she had a minor fever, necessitating a quarantine at a Newark, New Jersey, hospital. Ms. Hickox contested the quarantine regimen, ultimately threatening legal action. After showing no fever or other symptoms for a 24-hour period, she was discharged and brought to Maine, where she lives in a house in a rural area. On Thursday morning, Ms. Hickox left her home on a bicycle, followed by police officers who monitored her movements and public interactions. She returned home shortly after. Without a court order, the police were barred from detaining her. There is no legal action against me, so I'm free to go on a bike ride in my hometown, she said. Meanwhile, U.S. Ambassador to the UN Samantha Power, who has recently returned from a trip to the Ebola-hit countries, said the lives of a whole generation in West Africa depend on the world's ability to stop the outbreak. Ebola thrives on fear, Ms. Power said. She said it was well known what was needed to stop the outbreak, but the world needed to marshal the will to do it. While there are a few nations doing a lot to help, many are doing very little or nothing at all.